Can someone with a 7mm herniated disc avoid surgery and be pain-free? You certainly can. You've got to do your rehab though. You've got to do your rehab, and you need to understand this would be a good cause of sciatica, a very common cause of sciatica, some kind of disc herniation to the L5-S1 in particular, and the L4-5 segments in the lumbar spine. And what is happening here? And this is why, if, for example, in that case, we're struggling with symptoms down the leg, we're struggling with the symptoms of sciatica, maybe it's just some buttock pain, maybe it's back pain and pain going down the leg. We have to understand, especially with question of surgery for sciatica, what is going on here. We have a disc bulge. This is a healthy disc, right? You can see that the nucleus stays in the middle, and it is the annulus fibrosus that is holding it in place. And therefore, if we have the herniation of some degree, this is obviously a bit more of an extreme example. What has happened here? Yes, we might have the disc bulge pressing on something, the herniation pressing on something, but in most cases it's not actually directly contacting anything in any significant way. But we have a significant amount of damage to the annulus because it is the failure, the damage to the annulus that has allowed this bulging to take place. And so the surgical intervention might well remove that bulge, but it has done nothing for the healing. And so this is a valid source of sciatica, right? What do we have to do? We have to prioritize the actual injury that is down there in the lower lumbar spine. L4-5 and L5-S1, this one here, L4-5, these two greens, right? And then the segment, it's got a disc on the front, it's got facet joints on the back, and it's got a little hole where the nerve comes out at the side. And then we've got L5-S1, this one here, the green and the orange, right? And this is where the lumbar spine joins the sacrum. And we've got the little hole that comes out at the side here. There's tons of ligaments that protect and support these areas as well, right? That's very important. You don't get that on the spine here. And so the most important thing that you do is prioritize the injury. Negative gearing is said, subluxation. Yeah, I don't know about that, but don't know about that. The subluxation, the medical definition is when a joint pops out and pops back in again. Subluxation in the chiropractic sense is used, well, to mean something different. So we can't compare those two things. I would suggest choosing the medical definition rather than the commentary of chiropractic speak personally. It's just helpful for clarity, if you know what I mean. And so if we're prioritizing the actual injury at the root cause of sciatica, then we're going to do an awful lot more.